how are you going to handle the lymph nodes? This will be your question. So first thing you're going to tell them is, if I see a lymph node, first I would examine and I will not remove any of the fat surrounding it. Next, I would look for any color or a visible dye which is if it's seen, if any sentinel lymph node, if they have injected, and if you could see any dye externally grossly, if you're seeing, you have to mention that. If it is there, you have to mention. If it's not, I would check for it and record it. Like that, you have to mention. Okay, how are you going to slice this? Once you have grossly examined, you are going to slice this. As I said, see, if you are getting a lymph node, one lymph node which is less than 2 mm size, then you are going to embed this completely. You are not going to bisect, you are not going to do anything. In case, if you are having a lymph node which has 4 mm, more 2 to 4 mm size, then you have to be see, I'll, whatever the questions you put it in the chat box, I'll answer you at the last. Is that fine for you? Okay, so it's 4 mm. So if it is 4 mm, you are going to bisect it. You bisect it and separate into into two halves, and you are going to submit those in the separate two cassettes. And if it's more than 2 mm, then you are going to divide everything. See, 2 mm at the 2 mm intervals, you are going to divide it in a perpendicular. You are going to divide it and submit it everything. But how are you going to submit? See, if it is this two, you will just submit it as such. But if in this case and this case, the last two, the edges of the sections, you are going to place the piece downwards. This should be your cutting surface. This is what I wanted to make. This you can keep anyway. This can be up, this can be down, this can be up. So this doesn't matter, but the end of the piece, the cutting edge should be your cut surface. This you have to keep in mind. So they will ask you in the Viva as well, how would you handle, and they expect this answer from you. And you have to mention all in a separate cassettes, and you have to give up clearly mention which is what, which is the second half, which is the first half, all that you have to mention that. So this is important. Next, there is something called an ultra staging protocol in cervix for the lymph nodes. So what is that? See, once you have embedded, consider this section. Okay, you have embedded. This is one section. This is one section. You keep it. So this one section is this block. Okay. So one cassette, this is one cassette. So first of all, I'll tell you why we are doing this. This ultra staging protocol is to detect the micro metastasis. And in case of, if we have to determine a metastasis, what we are going to do, we are putting one CK. CK sometimes it will be indeterminate, and you know that there is a lot of possibilities to have the CK positivity, negativity, it confuses us. So sometimes we need an extra marker to put it. So to confirm whether the metastasis is present or not. So in that case, we need lot of sections so that we know, so that we are not, at the end, we are not saying that there is no tissue to perform CK or any other epithelial markers. So to prevent that, we are doing an ultra staging protocol. How are we doing that? So as I said, this is one cassette of the lymph node. In that, you are going to cut 200 micron intervals. Okay, so everything will be, whatever we are cutting, it will be 200 microns. How much you are cutting? Till you are exhausting that node. That node has to be exhausted. That is, the entire section has to be exhausted. Okay, and each, like one slide, or in one slide, you are going to have 4 sections. Like that, you have to divide. It's 200 microns for everything. Even this is going to have 200 microns, but you are dividing it into the 4 sets. So each 4 sections, it should be in a one slide, and rest of them, like that, you have to cut minimum 10 sets. But ideally, it is how you have to exhaust the node and you have to cut it. That is how it is. Okay, what are you going to do with this 4 sets? And you are going to stain. You are going to take only all the 4 sets. I mean, you are going to stain all the sets, all the 10 sets. For example, this all 10 sets, you are going to stain it, but in all the 10 sets, you are going to stain only the 2 slides. Rest of the 2 slides, you are going to keep it like a extra sections. If I need it, I will do it. Kind of that, you have to keep it. You got it? So the in every set, you are going to stain only 2 sections, one for HE and other for the cytokeratin. Rest 3 and 4 will be your spares. So in any of this section, for example, in this set, if you are finding a CK positivity or indeterminate CK, then you are going to perform in the other 2 sets. This is how you are going to do the micro staging of the micrometastasis, you're going to find it in such a way. So always remember this. This is important. See, why we are doing so much of effort to all this, because it has some significance. It has a very good significance that if even the patient who has a micrometastasis for the cervical carcinoma, you have to aggressively treat them with the chemo and the radiotherapy, because the if even the micromets is going to reduce the patient survival to 10 to 20%. Imagine, 20% is so much. So in that case, even finding a micromets is important. That's why this ultra staging protocol is important, and this will be asked in the cervical carcinoma if you get a specimen.